Good morning to all. Today we are going to discuss about the IV fluids. So IV fluids, otherwise known as intravenous fluids, it is used for intravenous therapy, mainly to reverse back the electrolyte balance and also the fluid loss that has happened because of many reasons like vomiting, diarrhea, dehydration or hemorrhage or burns. Because of that, some fluid loss which has happened to the body, it will be replaced by infusion of intravenous fluids. There are two different types of intravenous fluids are there, crystalloids and colloids. Now I am going to take small brief about this. Follow the first year students are going to explain in detail. Crystalloids and colloids. Crystalloids is having the smaller molecules. It is divided into isotonic, hypotonic and hypertonic solution. Isotonic, it has the equal osmolarity to the blood. The example is full NS, lactated ringer solution, 5% dextrose. It is mainly using vomiting, diarrhea and dehydration. Next, hypotonic solution. It has the osmolarity lower than the blood. The example are half NS and 5% dextrose. It is mainly used to increase the total fluid and gastric fluid loss. Next one is hypertonic solution. It has the higher osmolarity than the blood. Example, 10% of dextrose in water, 5% of dextrose in water and full NS. It is mainly used in severe hyponatremia and cerebral edema. When come to the colloids, it has the larger molecules, mainly it has the protein in it, and it is mainly helpful to maintain the osmotic pressure. Example, human albumin, dextran and gelatin. So I have given the brief introduction. Now the first year students are going to explain in detail. Thank you.
Of IV fluids, that is crystalloids and colloids. Crystalloids are solid particles. Unlike colloids, they are used for restore to fluid volume, and colloids are used to expand blood volume. And colloids contain protein molecules. And examples of colloids are human albumin, plasma protein fraction, dextrose.
So very good. So there are two types of IV fluid, crystalloids and colloids. So crystalloid, it has the solid particles. So it is mainly used to maintain the fluid volume as well as electrolyte balance. But colloids, it is mainly maintaining, it has the proteins in it, it is maintaining the blood volume. These are the certain examples of colloids. Okay, it's mainly used in case of severe type of hemorrhage in ICU settings. Commonly it is used. Next, I will call upon Varsha to explain about the types of crystalloid solution. There are three types of crystalloid: isotonic, hypotonic and hypertonic. First, Varsha is going to explain about the isotonic solution.
Isotonic solution, which means same strength. In
extracellular compartment.
In extracellular compartment and intracellular compartment
Has the
same concentration of fluid. It will not
cross.
shift.
It is mainly used.
It is mainly used for vomiting, diarrhea, low BP, dehydration. Example, 9% of NaCl.
Ringer lactate solution. Okay, very good. So isotonic solution means the iso means same strength. So it has the same strength. Both intracellular and extracellular compartment has the same strength concentration. So there is no fluid shift between these two compartments. It is mainly commonly used to maintain the normal fluid volume. In case of vomiting, diarrhea, hypovolemia, dehydration, increasing, maintaining the blood pressure, they are using. The common example for this 0.9% of dextrose. What was shown? This is commonly used. So it is having only sodium chloride 0.9%. Otherwise it is called as a full NS. Next 5% dextrose also it is commonly used. Next oral ringer lactate. This otherwise it has the high concentration of electrolyte in it. So to maintaining electrolyte balance they are using this solution. Next hypotonic solution. Mary going to explain the hypotonic solution.
Hypotonic solution, it has hypo means less and tonic means strength. It is less strength. It has 0.45% of NaCl, and in extracellular solution,
This is the example. You will tell these things. In extracellular.
In extracellular solution, it has 10% of solid concentration and 90% of water. And in intracellular solution, it has 20% of solid concentration and 80% of water. When the water from extracellular compartment shifts to the intracellular solution, the cell may get expand.
The cell get expanded.
Yes,
It is used for
cellular hydration and hypovolemia.
Example for this. What are the solution used as a hypertonic?
Normal
Half normal saline. Show the students. Half normal saline used for this purpose. Next, hypertonic. We need going to explain about the hypertonic solution.
Hypertonic means increased tonic is sustained. It is similar to the hypotonic. It has 90% of concentration molecule in the extracellular and the 20% concentration in the intracellular. Water of 10% in extracellular and intracellular has 80% of water. When transmitted of water and the water from the external to the
Intracellular to the extracellular.
Intracellular to the extracellular, the cell was
Gets shrink
and
the
the
cell death will
cell
occur
death
at the end.
happen in the stages of
It is commonly used for
hypovolemia and sodium deficiency. Example for 3% of normal saline and 5% of normal saline, and dextrose of
just 20% of water.
and dextrose 50% of water.
Water used as a hypertonic solution. Very good. So now everyone got the idea about the IV fluids. Now question session. So give example of isotonic solution. Anyone? Isotonic. Give example of isotonic solution. I didn't ask what are the uses. If you are saying that where it is used, you can tell.
It is used for vomiting, diarrhea, hypervolemia, dehydration, and low BP.
Very good, Shiva. So next hypertonic solution. Where we are using the hypertonic solution? Anyone? Cellular hydration we are using, and in case of hypovolemia we are using this to expand the fluid volume. Sit down. Next hypertonic solution. Give example.
Hypervolemia with sodium deficiency.
So it is used in case of hypervolemia and sodium deficiency. So any one of you give example. Give example of colloids.
Hemorrhage,
Blood volume. If it is blood loss has happened because of any kind of major surgery, they are using this. Example for colloids. This is the example.
plasma protein fraction, human albumin, dextrose.
So these are all the examples of colloids. So I think everyone got idea about the IV fluids. Yes or no? Thank you all.